they actually have no concept that they're in perimenopause. And that's because the earlier symptoms that I see all the time happening are insomnia, a rise in anxiety, some rage. And I mean, when I say rage, it's really its own independent issue. And some people that will just be extreme irritability, but for some people it is unbelievable, like very destructive and very scary because it feels very out of their control. So rage, and their cycles are like this, right? Clockwork. And they just have not connected because some of those changes don't just happen in the PMS zone, right? Like the few days before your period, they can happen all cycle long. So it's understandable that a lot of women don't connect it. They don't realize it. So for me, a lot of mental health, like anxiety, depression, there was a meta-analysis that came out a couple months ago by the University of Cambridge Press that examined mental health in the context of the perimenopausal window, which, give or take is about 10 years. And I got weepy when I read it. I mean, I still get weepy thinking about it because it just verified what I see, which is, to answer your question, is an overwhelming amount of mental health issues crop up during this time. And that's because when you look at the data, any woman who has a previous history of any diagnosis, whether it's generalized anxiety disorder or whether it's psychosis or major depressive disorder or bipolar, for all those people who are in remission, the chances of it coming back during this time are very high, which is extremely frightening. And what's even more interesting about this paper, this meta-analysis, is that it's evident that the regular medications that you would give for those disorders women don't respond in the same way. So you have a set of women who they have a resurgence of mental health, and they're obviously terrified about that because, I think let's also just call a spade a spade. Life in your 40s is aggressive, right? Like, I don't know what, some days
That's a great way to put it.
My parents are this happening, and then, my child, and then the dog, and then there's a flood, and then
career.
I don't even know what's happening. Yeah. And I'm trying to walk the talk and do all my self-care. Like, I don't know what the hell, but it's a lot of things are happening that we are supposed to be. So if you suddenly, have a little friend visit you, which that you thought you'd put to bed, which was your historic event with mental health, it is terrifying. But also it gets obfuscated by the fact that your life is a little bananas when you're in your 40s, right? So my point is, nobody connects this. Women go in seeking help because women generally want to take care of business with their health. Men, that's a whole other, those people are crazy. That's a whole other thing. They have issues with even admitting that there's a thing. Women just want to get it done. So they go and then they're prescribed their medication and they're not having a great response. So that is a fiasco that's happening. And then for women who are the lucky people who don't have a history with any mental health, it can come. And they can get really anxious and be like, what is this? And really not coping with stress and really sad or just really angry, but in ways that they absolutely know is not proportionate to what's happening. And that is early, right? And that stuff is special because, yeah, it might be really ugly the week before your period or a couple of days before, but it can be at any time. And that's very confusing if you're 42 and your cycle's completely regular, like you don't know what the hell's. So that I see a lot. And